First, I'd like to thank you for agreeing to do this vital work on behalf of your fellow Oregonians. Today, I'll be telling you about public health law. We'll cover what it authorizes us to do, what it requires us to do, and why maintaining patient confidentiality is so important. Across the United States, certain diseases are considered reportable. This means that the law requires doctors, laboratories, and hospitals to tell public health officials when someone tests positive for the disease. The Oregon legislature has given the Oregon Health Authority the right to write administrative rules that specify which diseases must be reported in Oregon, list the details that must be reported, for example, age, sex, race of the patient, and date the patient began feeling sick, and decide the urgency with which they must report. These rules have the same force as law, which means that doctors, laboratories, and hospitals must follow the rules or they face a civil penalty. Once a doctor, hospital, or laboratory reports a case of a reportable disease, OHA collects a lot of patient health information. This patient health information is protected by law, which means we cannot share this information with anyone on purpose or by accident. To help keep this information safe, we use our reportable disease databases, Orpheus and Opera. These programs are required to be more secure than most programs like email. We also need to do our part to keep this patient information secure and private. There are several ways we can do this, including 1. Don't leave paper lying around. If you have paper copies, lock them up when you aren't using them, and shred them when you don't need them anymore. 2. Don't discuss cases in public areas like elevators or hallways. 3. Lock your computer when you leave it, even if you'll only be gone a moment. As epidemiologists, one of our biggest challenges in keeping patient health information secure is when we export data from Orpheus and Opera to analyze them in our statistical software. It's challenging because even when we remove all names, addresses, phone numbers, and other obvious identifiers from our data, what's left could still be enough to identify someone. The best way to keep personal health information secure is to avoid exporting data whenever we can. If you do have to export data, use the OHA firewall and save it to a restricted access folder. Another way we protect personal health information is with security checks. For example, Orpheus and Opera log every search made. We understand that you may be curious, but remember that searching friends, family, and others is a violation of public health law. Searches that are not directly related to your work can result in disciplinary action or even dismissal. If you happen to be assigned a case of someone you know, please hand it off to someone else. In closing, I want to thank you again for doing this important work on behalf of Oregonians. Both our statistical analysis and our robust efforts to keep the patient health information of our cases secure are vital.